I'm Alessandra Biaggi, and I support universal health care in New York State, as well as the New York Health Act. I have many healthcare stories, but the one I want to share with you today is about my father, who has Parkinson's disease. In 2012, my dad was diagnosed with Parkinson's disease, and so from that point forward, the number of pills that he has had to take has increased and decreased depending upon how well he's doing each month. My dad is on my mom's health insurance plan. My mom's health insurance plan, which is actually through a public hospital, does not have a rider because it's very expensive to add prescription drugs. And so my dad is over the age of 65 and can include Medicare Part D, which is for prescription drugs. Even including that with his health insurance, there are still costs that my parents have to bear as a result of my dad's medicine. And so it's been really interesting to watch as each month pills are changed, and sometimes a pill that was $500 one month, the next month it's $1,400, and then the next month maybe it's $2,000. And so because my dad has noticed this and has paid very close attention to the amount that it's been going up and down, he has gotten on the phone with his insurance company and other companies to try to make sure that the pill is actually being priced properly. And so what we're noticing is that one month it could be Schedule 1, the second month it could be Schedule 2, and what that really does is it means that there's a different price cost share. And so these are two people, my mom who is working in a public hospital in the district, my dad who is an attorney, two very smart individuals who are having a very difficult time navigating through the healthcare system when it comes to prescription drugs. And of course, as time goes on, this is a progressive disease, and so they're going to have to be able to understand additional things like long-term care and what they can afford there. And so just watching both of them really struggle, honestly, to figure out what the best alternative or method is to make sure that my dad's needs are met at a very basic level is not only disappointing, but I know that we can do so much better. And the New York Health Act is one of the ways that can not only alleviate stress for so many families across the state, but it will give people peace of mind and let them age with dignity, which we should be doing across the board no matter what, but especially in a state like New York that is predominantly Democratic, that has progressive values. We should be taking care of every single New Yorker in this state.
Hi, I'm Andrew Gennardis. I'm running for the New York State Senate in Southern Brooklyn to represent the 22nd District, and I support universal health care, which is why I'm running on a platform to pass the New York Health Act once I win this coming November. My journey in the healthcare world and why I got to this point is a deeply personal one. A few years ago, I was in between jobs. I thought I would start my own law practice and pick up a few clients, maybe do some freelancing projects, but I could not afford the insurance that I would need to pay in order to keep myself protected. And so for almost 2 years, I lived in fear of crossing the street, of catching a cold, of getting ill, because I would not be able to pay my medical bills if, God forbid, something happened to me. And it shouldn't have to be that way. This is New York State, this is the United States of America. We are the 10th largest economy in the world here in New York, and the United States itself has the ability and the resources to take care of its own people in the year 2018. It's crazy to me that we live in a society where people have to sell cupcakes to pay for their cancer treatments, and it shouldn't be that way. No one should have to go bankrupt or to choose between putting food on the table or getting medical treatment or buying medicine for their kids. It's just not a reality that we need to live with here in the year 2018. And that's why I'm a staunch supporter of the New York Health Act and of universal health coverage.
Hi, my name is El-Behairy, and I support the New York Health Act because healthcare is a human right. Growing up, I suffered from really bad asthma and eczema and spent a lot of time in the hospitals in our district. I was fortunate that my parents were able to afford healthcare, but many of the children in our district are not as fortunate. We suffer from disproportionate rates of asthma, eczema, and diabetes in Central Brooklyn, and families should not be making the decision between healthcare and putting food on the table. It is a human right and a right that should be afforded to all of the families in Central Brooklyn and the rest of the state of New York.
Hi, I'm Kathleen Cleary, and I'm running for New York State Senate in District 2, and I support the New York Health Act. A few months ago, I attended a screening of a film introducing the New York Health Act, and it was hosted by the Long Island activists. A concern I had at the time was whether or not my insurance plan would change. I'm covered by my husband's union, and I was assured it would not. Not only would it not change, but I would no longer have to pay co-pays to when I go to my doctor visits. And also, under the New York Health Act, you will not have to pay deductibles, premiums, and it also covers long-term care. And it will cover all New Yorkers. That is why I support the New York Health Act.
I'm Emily Martz, running for the New York State Senate. I support the New York State Health Act. I support it because of my friend's late husband. He lost his job and therefore lost health insurance. He started showing signs of a heart attack, and his wife pushed him to go to the doctor, but he refused because he knew the financial cost of the tests. One morning he woke up with the classic signs of numbness, radiating waves of pain, and so he took himself to the emergency room. And it was at the intake window that he dropped dead. The United States is better than this. We are the wealthiest nation in the world. New York State, we are the 11th largest economy in the world. We can figure this out and be a leader for the rest of the nation. I support the New York State Health Act, not just for my friend's family, but for all working families, for our local governments, and for our businesses.
My name is Karima El-Behairy. I'm running for New York State Senate, and I'd like to talk about what universal health care means to me. Universal health care is a right. It's not a privilege. Universal health care covers you when you go to the hospital. It covers you when you go to your well visit. It covers your eye care, your dental. It covers mental health. It ensures that your stress levels come down. You're not stressed to find out what your copayment is, because there isn't one. It's emergency care. It is critical care when you need it. It prolongs your life, and it adds to the quality of your life. Universal health care for New York is now. It's not tomorrow. We need this. Hi there, my name is Karima El-Behairy, and I'm running for New York State Senate. I'd like to tell you a story about a family friend who's being impacted by the budget cuts on the VA. He currently has to make the choice between eating and walking. He is on a limited income, and he has to replace his bridge, and his occupational therapy clinic has just closed. And the new one that they have routed him over to is out of network, which means comes out of his pocket. This is a choice no one should have to make. I can't fathom why it's not covered. It should be covered. He served his country. Why do we need to make this choice? This is one of the main reasons we need universal health care in New York State. So these choices do not have to be made.
I'm Pat Strong, and I'm the Democrat running for New York State Senate District 46. I'm a supporter of the New York Health Act, and here's why. When our daughter was 3 years old, we learned that she needed epinephrine in the form of an EpiPen to be kept nearby at all times because of an allergy. At the time, the price seemed staggeringly high to us. It was nearly $100. Fast forward several decades, and now parents and others are contending with prices that are 3 times that for no good reason that anyone can discern. I support the New York Health Act, universal health care, because a central piece of the legislation is that we will have negotiations taking place statewide with pharmaceutical companies. It's the only thing that's going to rein in prices, and that's what we need to support in New York State.
Hi everyone, my name is Chad McAvoy. I'm running for the New York State Assembly in District 101, and I wanted to share with you my healthcare story. So not so long ago, but before the ACA was in effect, my wife and I decided to quit our jobs and strike out on our own and become freelance self-employed contractors. And that was fun. We were doing pretty well, but then we quickly realized that health insurance was going to be a major problem. And we suddenly came to understand that in the open market for health insurance outside of your employer, the costs were ridiculous. Like these were decent white collar jobs we had, but we couldn't afford to pay what was effectively twice our rent to insure ourselves. It just didn't work. Didn't make any sense. And furthermore, it wasn't clear that the insurance that cost that much was going to cover us in the event of any sort of actual need. It only seemed to cover you for certain things with huge amounts of co-insurance while you're at in just the right hospital in just the right way. It just was a huge expenditure that we could not afford. And we didn't get insurance. We were uninsured for, I think, a couple years. And the ACA came along, and immediately we could get insurance. It was still expensive. It was about half what it was on the open market, and there was some quality assurance and pre-existing coverage rules that allowed us to understand that it was worth buying, even though it was quite expensive still, because at least we knew it would cover us in the event of something happening, and we wouldn't go bankrupt funding our own hospital bills. And so I feel like the ACA got us part way down the path to the promise of universal health care, and that's why I support in New York State the New York Health Act, which will, I think, take us the rest of the way down that road. And it will provide universal health care access for the citizens of the state. And I think it will also become a cost-saving measure that saves individual families money, produces jobs, it results in better health outcomes for all involved, and actually produces jobs. And there's some studies that would back up those views. Furthermore, this is where the district that I'm running for becomes important, is that this is a district with a mix of small towns and very rural areas, and we live in places in this district, in the 101st, that are geographically have a disadvantage when accessing healthcare services. And so part of my argument for why it matters to have rural and small town representation inside the majority party of the New York State Assembly is that we need to have our voices heard and be in the room when big things like the New York Health Care Act go through, potentially in the next term, when large changes happen in the state Senate. We need to be in the room and make sure that it's not just that everyone gets covered, but also they're listening to small town, rural, geographical concerns about access to health care for everyone. So that's my feeling. If you want to learn more about me and my positions on this issue and others, please go to chad101.com.
My name is Robert Carroll, and I'm a New York State Assembly member here in Brooklyn representing the 44th District. And the reason I support the New York Health Act is because I think all New Yorkers should have access to health care. Just this spring, I had a root canal that had gone bad, and I had to get a tooth extracted. And even though I work for the state government, my health insurance didn't cover that extraction. And so I had to spend over $400 to get that tooth removed. And I was lucky enough. I had the money, I had the means to go out and get that procedure done. And it's a simple procedure, and anybody should be able to have access to a procedure like that. But I know that there are thousands of New Yorkers across this state that if they suddenly had a $400 or $500 medical bill, they wouldn't be able to pay for that, or they would have to forego paying that month's rent or buying groceries that month or paying a student loan, and that's just utterly ridiculous. And that's the reason why New York State needs to lead the way in the nation and pass the New York State Health Act so that all New Yorkers, all 20 million of us, have access to health care. It's the right thing to do, it's the smart thing to do, and at the end of the day, it'll save New York money.